Okay.
How you doing?
Hi everybody. We're going to be able to massage Lisa's legs. Lisa is on the receiving end of this massage, and Joffrey is her happy partner. When's your baby due?
November.
November, and it is now September, a couple of months.
Right?
Yeah.
This is great. So what I tend to do when it's a tandem, like say her mom's around or someone else is coming into labor and delivery with you too, besides someone like me, so you would teach them how to do this in tandem. It works really well. So we each get oil. I can give you a little of mine, Jack.
Okay.
And then what we do is we sandwich the foot to begin with, like this. She has very atypical feet. That means they're not typical. They are not swollen at all, even if they were thinner than this in the rest of the time. So try it this way beside me, because the heel of your hand, and Pete, if you want to come around to my end here, you'll see how the heel of the hand comes down like this. Come low with us, and you can see how we're really pushing. Doesn't that feel great?
Feels wonderful.
Okay, now the tricky thing here, Joff, is that we're going to go with this inside hand towards the inside. Okay, then we're going to line up. Okay, you cheated. You did that before? How did you learn to do
I'm just
that?
watching you.
First time?
I'm
I'm
just-
not that good at teacher.
Yes, you
Oh
did.
my God. Okay, we're going to the outside, to the end of the femur. Then we split hands, one on the inside, one on the outside, and no pressure coming back. So everybody, the big deal here, and if you want to walk it with us too, Pete, you can, is the pressure is always towards the heart. Okay, now we wrap into here, and we're pressing on the outside of her. So you've got the right posture there, Joff. I really lean onto my front leg, and this time we're going to part here. We're going to put a reassuring hand on her knee. We're going to roll the leg kind of inward, and we've got our hand where it's disappearing, Pete. It's going right underneath here, so I get the gluteals in the back. Then I take my thumb, Joff, and I'm going around the head of the femur. So I'm going right around. Yeah, you're right there. Yeah, where the bump sticks out. So it's right up around there.
Right there.
Yeah. Have we both got it, Lisa? Great.
Yeah, that feels really good.
You married the right guy, for sure. And then
think
let's
so,
come
too.
down that iliotibial band, Joff. And remember, it's sinewy, it's inelastic, and it hurts. So we're going to come all the way down here with that single-handed thumb kneading.
Just down the side.
Yeah, just down the side. The thing about it is, it's ilium,
Yeah.
tibial. So it's actually going past the knee and hooking up right there to that bump on the side of the knee. And then we're going to go up. This time we're going to go back with a steady thumb stretch. Just long and steady. And we have an athlete on her hands here. Lisa looks innocent, and we'll do our alternate thumb kneading to the quad. But she's actually Ms. Butterfly Stroke, so she's got just a really well developed body. Did you swim when you were little? And this alternate thumb kneading is just meat and potatoes of the whole menu here. So we can do it all over these quadricep muscles. But you know what the favorite is? Is this one, is the ringing. So again, step back, stick one leg out so you get the stride position. And then we're going to wrap way to the back. Because say she's comfortable on her back, Joff, and she doesn't want to turn to her side, then you can get all the underneath here. And where is our focus? Inner thigh. Because we need those gates to be open. And the trouble with the women in Nelson is they're mountain bikers. They are the toughest set of inner thigh muscles you can imagine. And Lisa's a birthing doula, so she can attest to that. So what I do is I slightly tilt them out like that. And then we go and we alternate thumb knead that inner thigh. These ones are called adductors. They have to do with pulling the leg in. And what we want it to do is unnaturally lie open with a huge amount of excitement going on there, which makes you feel like you just want to get your knees together and keep them together forever. We actually want to encourage everything from sitting on hot water bottles to this kind of massage, and it's all up there.
Okay.
And
So
you know what's
we're not
easier?
writing down.
No, we're just staying right up in this corner. Then here's the other one, Joff, that really works. And if you can get in on this one, Pete, it's a fingertip kneading, and it's actually a smaller stroke. I'm going to tuck this right under. So then you can see tips. You're exactly right, Geoff. You got tips. Is that too much?
No.
Okay, good. I think her pain threshold might be really tolerable for firm pressure.
Well,
So
we
you're
hit each
lucky.
other with sticks at home.
You're so bad. And slow it right down. Slow.
It's a good birth prep, right?
Yeah, right. And then you can get the thumb in there too. So the more work you can do in the next 2 months on these inner thigh muscles, the better.
Abductors.
Yeah. And right underneath. Now what we're doing here, Pete, we're going underneath and we're picking up like this where you can't see us. So you take your thumb with you there, Geoff.
Okay.
And then we're right underneath, kind of like where the ischial tuberosity is, like right here.
Okay. So a
And
little
then-
further in.
Yeah, a little further up. Come on up higher. A little more up there.
Get there.
There we go. Right around there. And then lift up with your fingertips.
Like this.
You got it. How do we feel? Similar?
Really similar, and that's been really tender. So
Good.
It feels really good.
Okay, so I'll show you another way to work that besides getting her on her side. Is we bring, and one side more than the other, Lisa?
This side.
Yeah, she was pointing
more
there.
so.
So watch this, Geoff. So we can take this and then we bend that way and then we go looking for trouble like that. So if you come around to me, this is a really easy, never was I taught this, but I always find, so I've got my elbow here.
Yeah.
So I've got her kind of coming towards me au naturel, and then really work with your tips right down there. And that levering up, so you're kind of pushing in.
Am I pulling towards me?
Well, this pulls down, and then it's more a pivoting on the tips.
Okay.
That feels really good.
Yeah,
It's
come
just,
with
like,
me.
nervy.
Okay.
There we go. Oh yeah, feel that ischial tuberosity right there?
Yeah.
There you go. And really,
Do I have it?
and those are all the hamstrings that attach there.
Okay.
That
Good.
feels great. Yeah.
Your eyes are watering.
Yeah, that's been.
Have we got
like,
it
really-
right on?
Mhm.
Perfect.
Totally.
So I mean, I think we've nailed where you want to focus in the next couple of months.
Awesome.
Nice work.
Thanks.
Okay.
He's so
Okay, so that is a really good finale, and we've got lots of what we need happening here. That isn't in the book. We're gonna have to edit something into that ebook, the Geoff and Lisa special. But let me show you the other favorite part here. So we
Oh,
did
that
the
feels
alternate thumb. Try the ringing, and when we ring, the trick here is to ring way over, so we get our thumb. Yes. And Pete, you might want an angle on that one with a bit more light, because we want to get that coming like right across, slicing the top of the patella. And watch the bottom thumb, everybody, because it's slicing right across that common patellar tendon.
Do you go past?
Yeah, I go right past so that I can cut it when I'm going back again. Doesn't that feel great, Lisa? And it is so relieving to the whole leg. It's just fantastic. Nice work. Yay. We got it. And then, okay, here's the trickiest one. We're going to do an alternate thumb kneading,
Oh.
Geoff, and it's going all around the perimeter. So come around this way and line up your thumbs like this. You might want to get right over our shoulder for this, Pete, because it'll make more sense. Because, okay, so this inner one, we're going around,
Around
And
up
up.
to the outside and up.
and then this one.
To the upside and around?
Okay, you cheated. You went on YouTube and you
No.
memorized
Which?
this. You did it perfectly.
So
You did it
is
perfectly.
So it's opposites?
Yes. It's now just don't dislocate the patella on your way around.
Oh, okay.
Okay.
Yeah, that
So
would be bad.
it's perimeter. Yeah, nice. Excellent. Okay, and let's go down the outside of the, here it's called the tibialis anterior, and it's kind of where people get shin splints. And now we go little tiny alternate thumb kneadings. And I think that Geoff has got better light than me, Pete. And what you want to do, Geoff, is put your thumbs on mine, because we're going to go out, out, out. So a little bit more circular,
Okay.
and slow it down a tad, and you'll get more depth. So we really want to take it slow. How's our pressure, Lisa?
great. And similar. Yeah.
Good. Great. Okay. And now we're coming into the ankle. So everybody, you can just stop this film. You can rewind it. You can do that 13 times. But we're moving down to these ankle bumps. And we're going to do a bilateral thumb kneading. So both thumbs are going around at the same time. You are a whiz kid.
I'm just watching
I can't believe that you teach computers when you should be having 13 children. Okay, and around we go. And around. That's really nice.
I don't know about that.
Great.
Yeah, I don't know if I want any more kids than I have hands.
That's a good way to put it. And then let's ring the top of the foot back and forth.
Is it still with the...
Yeah, the thumb ringing is great. And then we're going to squat down. So Pete, I'll have to get right over our shoulder for this. And we're going to do this kind of thing. Even though we don't have great light, well, let's pick our feet up and then they'll show better to the camera. Oh, yeah, it's really good. Doesn't that feel great, Lisa?
It feels amazing.
You're really good at that, Geoff. Great. And next time I'll show you all the, what I call care for the caregiver. So how to do Geoff's shoulders. Oh, but you know what? It's on my YouTube channel anyway. So I think it's called Computeritis. That's perfect for you.
I thought care for the caregiver was just bourbon.
You're so good. Okay, and let's do our heels like this.
So should it be a mirror of what you're doing? So
Yes,
this would go
please.
the other way?
This, yeah, so that
So
one
I would do
you could
this.
put on there. You got it. And usually I'm over on your side a lot because people aren't so fast to pick it up. So I don't usually like them to try and interpret the mirror image. Okay, and then let's wake her up. Rolling to Boatman. I'll beat you over the bridge. Up Pulpit Rock.
Nuh-uh.
Get on the other side.
No way.
Okay, along the lake.
I'm a little out of shape.
Up the steep hill by the Prestige. There we go. Oh, and then we can do that light reflex stroking, which I think is page 57. This time, Lisa, I'll let you hold the book, because Pete will always say, did you tell him about the book? There you go. So all of these techniques, everybody, you'll find in Birthing in Good Hands. Look it up. There's only one of it by Brush Education Inc. It's Canadian. It's got to be the best. Except you're from Seattle.
It's okay.
Yay
We
for
wanna be
Seattle.
Canadian.
Can you tell us what pages those were on
Oh,
again?
okay. I can't. So legs. Let's look up legs. Well, you know
Okay.
what? You can probably even look up legs in the back. But we've got lots of feet things here. It's chapter 3. Then we've got pictures too showing how to do that tibialis anterior. Oh, that's really great. I even talk about that. And then we've got ways also, if Lisa was on her tummy, Geoff, that we could do that. We can do the calf face up like this or face down. Actually, let's throw that on. There's some of that ringing. And that is all coming along around page 80 to 90. But watch this. So, Geoff, if you take that side, I'll take this side. And we can also... Okay, so this can go like this. And then what we can do is split that gastrocnemius with our fingertips like this. Or we can take two hands. And what we're doing is splitting up the middle. Yeah.
Right at the calf muscles.
Yes.
Splitting it right in two.
Here we go. So it's this kind of grip.
Okay.
But you get that idea.
Yeah.
I tend to hold like this or hold like that, but this gives them less opportunity to hold on if you're underneath. Then you've got control of it. Yeah. That's so that, like, her legs might get crampy when the baby's head is dropping. And sometimes the legs get cramping because everything's being squeezed because it's going from there to there in quite a short period of time. So those kinds of things often get spasming happening, and just this kind of thing, just keep grabbing the legs because her legs will be out at either side. I'll just show you how that goes. So you take a knee out to your side and I'll take a knee out to my side. Okay, so she's like this and we're gonna try and get these to really, so we would be going like this.
Massage.
Yeah, in between contractions, we do all this kind of thing. And then, oh my gosh, she's getting a contraction and she's on her back. Holy smoke. Okay, so we put these down, we get underneath here, and we get a hand, get that draw sheet, right underneath her sacrum, and then we just lever up. So we got that same pressure coming in, press up, press up, press up. So I'm right in the center there. And then now I'll let you get in so I'm not hogging it. Get right in the center. Is he about where I was now, Lisa?
Almost.
Keep going. Yeah, and then push down on the
There?
surface and press up with your hand.
So,
And you can get both of them. And you just want to press on that. Because for
There.
some reason, she might be fine delivering like this. But it's like when we had her on her side, we could push. But this is where you can get underneath. And often I use the draw sheet for quick access,
I
right?
see.
So use
Do
the
that
draw
again.
sheet. Okay, so I use the draw sheet for quick access because Lisa's going to have a contraction. We don't have time to get her on her side. Lift up, push right under. So get right where her sacrum is, lower back. There you go. And then get down and then press up. And even if it's fingertips, it really helps when you get the pressure coming at her because she's got the pressure on the inside. We're kind of like equalizing it. And nice deep breath, and we press up, press up, press up. Let everything go. And even as it peaks, stay steady. Then it comes down the other side. Pain is lessening, pain's gone away. And then massage it with your fingertips. So don't leave it just with a pressure hand thing.
Got it.
Thank you.
Thank you.
I feel like we learned like 9 million things.
You did.
I
Once.
know.
And I think, Pete, if we showed what we were doing with the pressure on the sideline, that would be helpful, eh? So let's do that one again, Geoff. So we'll get you on your side. I'll throw that one at the